Let's turn our attention to the Ontario Legislature, where Premier Doug Ford is expected to announce plans for Stage 3 of the province's reopening. Let's listen in live.
Regions are reopening fewer than 5 new cases a day, with 21 reporting none at all. We're continuing to see a decline in case numbers and in hospitalization. So today, we are ready to take the next step. 24 regions in Ontario, the vast majority of our province, will be able to enter Stage 3 this Friday, July the 17th at 12:01 a.m. This includes all communities except the following regions: Toronto, York Region, Peel Region, Durham Region, Niagara, Windsor-Essex, Haldimand, Norfolk, Halton, Hamilton, and Lambton. As we all know, these regions entered Stage 2 later on, so we need just a little more time. I want the people in these regions to know that we won't leave anyone behind. And we will provide an update every Monday on regional reopenings. We will keep working until every part of this province gets to Stage 3. My friends, this is great news. We're moving forward as a province, but we can't stop. We won't stop until we get every person in Ontario, until we get every worker in Ontario back to work and back on their feet. But today's news is an important step forward. It's an important step in getting life back to normal, and this will mean expanding the limits on public gatherings in regions as they enter Stage 3. The new limits will allow up to 100 people to gather outdoors and up to 50 people indoors. At all times during these gatherings, people must continue to practice physical distancing with those outside their social circle. And Stage 3 will also give another boost to our economic restart. Nearly all businesses and public spaces will be allowed to open their doors safely. So today, I'm glad to announce the following businesses and places will be allowed to open in Stage 3. Dine-in restaurants, bars, gyms, and fitness centers. Most personal care services, live shows, performing arts and movie theaters, casinos, recreational facilities and activities, team sports and live sporting events, and tour and guide services. We have over 170 workplace resources available online to help all of these places reopen safely. And a key part of getting people back to work is making sure parents, workers have their childcare support they need. Minister Lecce will have an important message today to update on how we're supporting parents as they return to work. And I know that parents want to know what school will look like this fall. My friends, let me be clear. I want to see every child in Ontario back to school full-time this September. This is what we're working towards with the support of our medical officer of health and our local school boards, and I'm confident that we will get there. But we will not take unnecessary risks when it comes to our children, and that's why we have to continue planning for every possible scenario to keep our kids safe as they get back to school. My friends, we're making steady progress, and we're supporting our own, and we're coming back stronger than ever before. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. Today, we are taking another important step forward in our journey to reopen our province. We are only able to begin moving the province into Stage 3 because of the considerable and ongoing efforts of all Ontarians to stop the spread of COVID-19. Physical distancing, wearing face coverings, practicing good hand hygiene, and keeping our social circles safe have been critical in helping to achieve this milestone today, and they will remain critical. We are asking everyone to continue these everyday actions to help keep our friends, neighbors, and family members safe so that we can continue to safely enjoy the loosening of restrictions. As we've done with Stage 2, we will continue the ongoing assessment of all regions and will advise whether a specific region is ready to move into Stage 3 every week. As we do, we will be able to safely move every region of our province into Stage 3, so long as we continue to see public health trends move in the right direction, as they have been. Once we take this important step forward, we expect the province will stay in Stage 3 for the foreseeable future. In recognition of the fact that we will remain in stage 3, our Chief Medical Officer of Health and public health experts will continue to closely examine the evolving situation to advise our government on when public health restrictions like the size of social gatherings can be gradually loosened. At the same time, they will diligently monitor for any spikes in cases and may recommend these same measures be tightened to ensure the safety of all Ontarians. Thank you, and now I'd like to invite Mr. Phillips to the podium.
Thank you, Minister, and good afternoon, everyone. From our initial response to COVID-19 on March 17th, when we declared a state of emergency, and on March 25th, when we announced Ontario's action plan responding to COVID-19, and through our safe and gradual staged approach to reopening our province, starting with a framework to reopen our province on April 27th, through stage 1 on May 19th, and stage 2 on June 2nd, our goal has been to restart the economy as quickly as it is safe to do so. As you heard from the Premier, almost all businesses will be able to reopen in stage 3, as long as they follow health and safety guidelines. In fact, when a region moves into stage 3, almost 99% of the local economy will be available to reopen. We must work together to ensure that the small but important number of businesses still facing restrictions in stage 3 are able to open safely as soon as possible. The government is committed to working with those not currently moving into stage 3 to consider innovative ideas to modify their operations so they can adhere to the principles of our public health experts who will tell us that we can open them at the appropriate time. They can visit ontario.ca/reopen to submit their plans. As the Premier has said on numerous occasions, no business should reopen until they feel safe to do so. It is through our collective efforts that Ontario is in a strong position amidst a global pandemic that is continuing to take a human toll here in our province and unfortunately to a much greater degree in some other places beyond our borders. We're in this position because we have made the choice to act responsibly and treat each other with respect. Whether it's wearing a mask when we can't physically distance, working from home when possible, or adjusting our businesses to adhere to public health advice. As we enter stage 3, choosing to act responsibly and respectfully is more important than ever to avoid taking a step backwards. We may be in stage 3 for a while, but our economic recovery has already started. We remain committed to supporting people and businesses who are struggling because of COVID-19. They have done their part, and they can count on us to do ours. Thank you, and now I'll turn it over to Minister Lecce.
Well, good afternoon. In early March, we made a commitment to Ontario parents to ensure our kids remain safe and ensure parents can return to work with confidence. We did that by allowing the childcare sector to reopen in mid-June. That is why on July 27th, all Ontario childcare centres will be able to operate in increased cohorts of 15 children with continued strict health and safety requirements in place. We know how critical childcare is to ensure that all working moms and dads can return to work safely. So today's changes will allow the sector to reach approximately 90% of the capacity that existed pre-COVID. Make no mistake, when it comes to your kids' safety, we'll do whatever it takes. We also know that parents and students are looking for clarity around what school will look like in September. And as I've said since we announced the plan for the return to school several weeks ago, we need to be prepared for all eventualities and adopt a prudent flexibility for whatever path the outbreak takes. This has not changed. As the public health data has improved over the past several weeks, we've been working closely with medical experts to enable conventional daily delivery in September. This plan will continue to put health and safety at the absolute forefront, as it always has been. We will be cautious, methodical, and focused on safety to get this right, because keeping your child safe is what matters most. I'll be sharing more details soon about the return to school plan, which I know is top of mind for many parents around the province. We are confident in this plan to enable parents to return to work while having the peace of mind that their children are cared for. Thank you.
Okay, we'll go to the phone line for questions. First question.
First question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. Wanted to ask you about the length of stage 3. Minister Elliott alluded to the fact that this will be the reality for the foreseeable future? Does that mean until we have a COVID-19 vaccine? Is it a year? Is it a year and a half? I'm wondering if you can tell us about that.
Well, maybe I'll pass that over to the Minister of Health.
Well, certainly we're all hoping that there will be a vaccine in short order, but apart from that, we will remain in stage 3, but depending on how stage 3 moves forward in different parts of the province, if we keep our numbers down, if there are no new outbreaks of COVID-19, then we will be able to gradually expand things like the size of gatherings, for example. Right now, it's 50 indoors, 100 outdoors. We may be able to increase that number, but that will be a gradual loosening of the public health restrictions still within stage 3. There will be some areas that are still not considered safe to open, for example, amusement parks, water parks, dancing in bars and restaurants, karaoke bars, and some of the other things, because there's still some obvious concerns about that. But we will be following that, and at such time as it's considered safe, when we don't have increases in our numbers of COVID-19, we'll be able to loosen them. But certainly the vaccine would help, but we're not counting on that in the next very short while in any event.
Follow up.
Maybe a follow-up for Minister Phillips, actually. Minister, you mentioned that there would be supports in place to help businesses that would not be able to reopen. But isn't what those businesses really need is financial support rather than reopening plans?
Well, I think all the businesses that I've spoken to want to reopen. And so, as Minister Elliott pointed out, there are some businesses that right now the best advice of the Chief Medical Officer is shouldn't be reopening. But if you take amusement parks, for example, one of the things that those businesses will have the opportunity to do is submit their approach to reopening. So we want to remain open to their ideas and their suggestions about what's necessary for them to be able to be safe. In the meantime, of course, businesses do have access to the wide array of supports that have been provided both by the provincial government and by the federal government. But as I said, in the regions that are reopening, 99% of businesses will be available to reopen. Now, I should just reemphasize something the Premier has said, which is that no business, no part of our economy should reopen until it feels safe to do so. But the fact that we've gotten to the point where there is probably less than 1% of the businesses that can't reopen is a good sign. It's a compliment to the 14.5 million Ontarians and the work that they've done. And we'll continue to work with that small but important group and work with the Chief Medical Officer to see if there's a way to have them reopen safely. But of course, safety is our top priority.
Next question.
Next question comes from Chanel Call from CP24. Please go ahead.
Hi, Chanel.
Hi, my first question is for Minister Elliott, if possible. Just wondering, based on the case data that we have right now, how close is Toronto and the GTA to moving to stage 3?
Well, there's several other communities that moved into stage 2 before Toronto did. We expect that it will happen in the same way because the Chief Medical Officer of Health and the public health officers at the command table need to see about 4 weeks data to understand what's going on locally, to make sure that there are no further public health concerns. So we expect that the next group will be the second group that moved into stage 2 will be the second group to move into stage 3, just because of the time frames that have elapsed, and then Toronto will follow. So those are the general terms that we're looking at it in terms of reopening, because of the fact that we need to have that public health data. Even up to last night, we were still receiving data before the public health officer felt that it was safe for these 24 units to move into stage 3. We'll be looking at that as well for Toronto.
Follow up.
And perhaps a question for the Premier, just wondering, there are some industries like you spoke about, like amusement parks, big sporting events that are not included really in this stage, and this is the final stage. So if there isn't, specific financial support for those industries, how do you expect those businesses to survive when really they rely on large-scale gatherings, which they can't have for now?
Well, what we've always said, our goal is to open up everyone, and there are certain circumstances, be it large concerts, right now at this point, unless the Chief Medical Officer of Health approves it. But I'll give you an example for banquet halls. If they can come up with a proper plan, or smaller amusement parks can come up with a proper plan, it can go to the Chief Medical Officer. If his team approves it, then they can open up. We don't have to put another order. We don't have to change the order. But I encourage as many people as possible, put your plans together, and let's see what the Chief Medical Officer of Health says.
Next question.
Next question comes from Travis Danrash from Global News. Please go ahead.
Hi, Travis.
Hi there, Premier. Good afternoon. So I know that you guys have struggled with areas in the GTA when it comes to the numbers, particularly Etobicoke and Scarborough. And I'm wondering if you or the Health Minister could just touch on why more aggressive measures aren't being taken in those areas to get the numbers down.
Well, actually, we did take aggressive measures. We sent in the mobile units. We set up testing right by Humber College. You can drive through there any single time or go to the local hospital or the testing center. And that goes for Scarborough too. We rolled into Scarborough with 2 mobile testing units, and it was a big success actually. So the numbers have come down, and we're going to continue monitoring it. But for Toronto, they opened up later along with a few others, and as the Minister of Health mentioned, we have to see 4 weeks of data to take a look at it, and that's what the Chief Medical Officer would like. But I hopefully, and I'm hoping, if the cases continue declining like we've seen, then we'll be able to open up in stage 3 in other regions, hopefully sooner than later.
Follow up.
And, you know, a lot of the businesses that will reopen, gyms, for example, you know, I think of the one in my neighborhood, they're having to incur a lot of expenses for PPE and for just, you know, plexiglass barriers and things like that. Why can't the government set up a fund for some of these businesses? Because they're taking a hit because they haven't had customers in a very long time, and now they have to go through all these additional expenses.
Well, first of all, there's a lot of areas that they can go online and look at some of the areas that we can support them provincially and federally. But to be very frank, if we funded every single every single company in the province, we just don't have the money. It's very simple, but there are a lot of opportunities for companies to go out there and take a $40,000 loan from the federal government, and a few other areas that we're supporting them in, no matter if it's the rent subsidy or other areas, reduced hydro rates. So we're doing everything we can to support these small businesses. But the best way to help them, let them open their doors and get their customers back.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Hi, Lucas.
Hi, thank you very much. For Minister Lecce, I want to go back, if you can, to the cohort increase and getting to 90% capacity. So are you saying that that's going to be effective July 27th, will be in that 90% number? And for that 10%, that's still going to mean a lot of kids that either could have had a spot will not. How is that going to be accounted for? Could you clarify those points, please?
Yeah, thank you. Our commitment is to make sure that we put in place a health protocol that keeps these kids safe. We've done so during the emergency phase of childcare. We've done so during the next phase of our recovery. And today what we're signaling is as of the 27th of July, operators that are open or not can operate using a cohort of 15 kids plus the ECs. That is what the Chief Medical Officer of Health has endorsed and supported, while maintaining strict health and safety protocols. By doing so, by reopening according to a 15 cohort from 10, that will cover roughly 91% of existing capacity pre-COVID. That is a good thing for many parents of the province as they return to work. We're obviously maintaining the permission of permitting it to be permissible for home-based childcare to continue during this period. Summer camps are coming online, and summer schools and some boards. So there are plans in place to ensure that we really try to cover as many parents of the province to ensure they can get back to work as the economy recovers.
So how confident are you, Minister, that you will actually reach that? Because we still don't quite know exactly how many daycares have reopened. So how confident are you that we're going to hit that 90%? And if I could squeeze in one other question, do you think there's enough capacity for school to have additional classes in just other schools. That's something that came out of the Catholic Board's draft today. Do you think it's possible that we're only going to need those other, elementary schools and high schools for additional classes, or are we going to have to look at, other municipal buildings?
What we've heard from childcare operators, I visited one as recently as Friday, we've heard from AMO and from a variety of municipal service managers, from people in the front lines, our ECEs, is they wanted three things. They wanted clarity and a 2-week heads up minimum to enable them to reopen. We've done that. They want us to maintain the funding to ensure that as capacity, that differential in capacity continues to be funded by the province. We're doing that in conjunction with the federal government. And they, of course, wanted us to increase the cohort in a methodical way that aligns with the public health advice to keep the staff and, of course, our kids safe. We're doing that. We think that plan makes sense. It'll support the reopening of our economy, help people get back to work. And we do have confidence we will reach that capacity over time. Obviously, as the Premier and the Minister of Finance has said, they're permitted to open as of the 27th. Of course, operators will take the time to get it right, but we know with this type of notice, we'll give them, a sense of planning certainty, and we'll get them up and running as soon as possible. With respect to schooling, the fact is the government continues to prepare for three circumstances because that is the prudent way forward, to make sure that the continuity of learning is not interrupted as a consequence of the challenges that could manifest in the fall. And we see in other jurisdictions around the world that these challenges are manifesting before us. So we have to get this right, be thoughtful, and make sure that health and safety remains the guiding principle. We've said to school boards that they can be innovative when it comes to spacing and classes. We've also indicated that because of the work of the people of this province, adhering to public health advice, because of our collective efforts, we're in a much different reality than we were a few weeks ago when we announced our plan for schools. And that gives us promise that we can get back to daily conventional learning, as the Premier has indicated, is clearly the preference of working people in this province. And so we're going to be working with Dr. Williams over the coming days to provide that certainty and to enable school boards to have more of that sense of guidance on utilization of classes, both in schools and outside of schools, for the way forward.
Next question comes from Robert Benzie from the Toronto Star. Please go ahead.
Hi, Robert.
Hi, Premier. I'm just a little confused about the stage 2 to stage 3 timetable. Toronto lagged, specifically Toronto lagged behind, obviously, other regions moving into stage 2. But the minister, the health minister, said that it might take 4 more weeks of data. So does that mean that Toronto might have to wait until middle of August before it can enter stage 3 if the coronavirus numbers remain low?
No, what the minister said is Dr. Williams likes to see 4 weeks of data and review it. So hopefully it'll be sooner than later, but maybe the minister wants to clarify that.
Sure, I'm happy to clarify. It is 4 weeks of complete data. Several weeks have already happened for Toronto. So the next group would come up presumably next Monday for opening on Friday. Toronto would be in the next group, so they need to have that full 4 weeks. So you don't start again all over with 4 weeks to count Toronto's data. Half of it's already been calculated and we've already seen it. I hope that helps.
Follow up?
Yeah, thanks, Minister. Premier, back to you. We see that amusement parks and water parks are not permitted. You were saying earlier in the pandemic that Santa's lobbying you directly.
Yeah,
does that mean that parks like Santa's Village, places like that, aren't going to be open? And why can't water parks open, given that splash pads, for example, have already been open?
So before I pass it over to the Minister of Finance, what I understand, and let's use Santa's Village, great place, and hopefully people can go visit soon. But if they come up with a proper plan that keeps people social distanced and in other areas and puts it forward to the chief medical officer and they approve it, then they can open and we don't have to put an order through at all. And that goes, for what I understand, for banquet halls and other water parks as well. But I'll have the Minister of Finance clarify that.
Hopefully Santa's been registered in the lobbyist registry because he's been working very hard, as the Premier mentioned earlier. So yes, the Premier is exactly right. The amusement parks and water parks, the reason that they're being held back is because the Chief Medical Officer at this time, and as I said, 99% of businesses are able to reopen, but there are a small portion that, because of the danger that COVID-19 presents and because of the large groups generally attending at those sorts of facilities, that the Chief Medical Officer has said they are not able to move into stage 3. However, we have asked them to put forward safe reopening plans, and then the Chief Medical Officer will work with them and with us to see that those plans, if they meet his expectations, could reopen in some sort of a modified fashion.
Next question.
Next question comes from Cynthia Mulliken from City News. Please go ahead.
Hi, Cynthia.
Hello, Premier. I'm wondering if you can explain why the social bubbles have not been increased. Public gatherings have, indoor gatherings have, but not social bubbles. They're staying at 10. Why not increase it to 15 or 20?
Well, I'll have the Minister of Health answer that. Thank you.
Well, the social circles will stay at 10 across the province, regardless of what stage people are in. We can probably expand them as time goes on, but this is where physical distancing does not have to be maintained within this group, and that is based on the advice of the Chief Medical Officer of Health. We want to have a gradual movement of reopening the economy and reopening social connections as well, because we've seen what's happened in some other jurisdictions where it's pretty frightening, actually, and we want to make sure that we do this properly and safely here in Ontario so that we don't have to move back in the other direction and backtrack and close things up. We want to make sure that this is going to be safe for everyone, but the social circles will be something that we will take a look at as we move through stage 3, and we will be able to gradually expand them, but just not right yet.
Thank you. And my next question is about long-term care, Minister, and I'm wondering, I know families are allowed to see their loved ones once a week for 30 minutes. Is there any plan to open that up further? Many have been begging to be allowed in and be their caregivers as well.
Well, I know that is something that many people have voiced their concerns about. They are happy that they're able to see their loved ones outside, but they're still, in most cases, not able to approach them, to touch them, to be close to them. So I know that some people want to be able to do that and want to be able to move inside as well so that they can help with the care of their loved one. That is something that I know is under active discussion with the Minister of Long-Term Care and the Chief Medical Officer of Health. It isn't something that can happen just yet, but we hope that it will be fairly soon, because I know that this has been a really difficult situation for family members as well as their loved ones who are in our long-term care homes.
Last question.
Last question comes from Mike Crawley from CBC News. Please go ahead.
Hi, Mike.
Hi, Premier. Given the number of incidences in the States, even in Quebec, out west as well, that has been linked to bars, outbreaks of the coronavirus, why does Ontario feel that it's safe to open bars for indoor serving customers indoors at this point in time?
Well, we take that advice off the health table and the Chief Medical Officer. We're going to contain the sizes. Amount of people within the bars and social distancing. They won't be up there dancing and singing away, but they can go in there and have a drink at the bar or on the patio. And we have to eventually open these restaurants up and get people back on their feet. But so Mike, you aren't wrong, because I see these numbers from Florida and they're staggering. 15,000 people that contacted COVID in a day. That is scary, but we're being pretty vigilant. We aren't rushing into anything. We're opening up slowly in stage 3 and being very, very cautious about it. But you make a good point.
Follow up.
And if you could clarify something about the limit of 50 people indoors for the maximum size of gatherings. When you look in the section of the document about cinemas, movie theaters, and performance stages, it says that this applies to the entire facility, regardless of the number of theaters. So can you clarify, or maybe Minister Elliott can clarify, if that means that you'd have a 50-person limit even if you're talking a multiplex cinema? Would that be correct?
So, Mike, if I didn't know different, I swear you were listening to the questions that I was asking the Chief Medical Officer last week on the cabinet call, saying, hey, this doesn't make sense. We have cinemas that have 12, 15 different theaters, and what are we going to do? Put 50 people in the whole theater and one in each movie theater? So I'll send it over to the Minister of Finance to clarify it, but it goes back to the same Santa's Village. They have to come up with a plan. They have to get it approved from the Chief Medical Officer. Thank you.
Yes, Mike. So as the Premier said, theaters would be subject, cinemas particularly, would be subject to that 50-person interior gathering limit. Now, that would not include, as you'd see in the document, staff, but that would include patrons. This is an area where Minister MacLeod has already been working with the associations that represent theaters to work on that safe reopening plan that I talked about. So, the kinds of considerations that the Chief Medical Officer is concerned about, of course, is, how many washrooms are there, the concession stands, making sure that there aren't too many people. So it isn't just about the theater rooms themselves, it's about the broader facility. But this is an area where, as I said, we've committed with those very small number of businesses that aren't part of the 99% that can reopen when they move into stage 3, to work with them, to work with the Chief Medical Officer to try to make sure that they can reopen, but only when they can do so safely.
Thank you.
That's great. Thank you, everyone.